You are tuning in to Living Mentally Well with Kevin Hines. Follow us as we interview some of the greatest, most influential minds and public figures in the fields of suicide prevention, entertainment, activism, mental and behavioral health. We welcome you to listen, learn, watch, and enjoy.
My name is Jessica Drizin. I am a research executive with a company called Branding Science, and it's a pharmaceutical market research company. So basically what we do is design research materials and interview doctors and patients and present the findings to these pharmaceutical companies so that in order to help them create and build stronger brands for the drugs that they're selling. I think one thing that pharmaceutical companies can do, or that they should avoid when marketing their drugs, is keeping their message about depression and suicide vague. Because I think what people seem to see when they see these advertisements, whether they're in magazines or on TV or something, is that like pretty much everybody can relate to some of those symptoms sometimes or at one point in their lives. So I think it's kind of a matter of trying to find a balance between finding these people that really need these medications, but without trying to advertise it to everybody. And I think that's where a lot of companies go wrong, is they're trying to advertise. And when it comes to mental health, it is kind of a vague idea, or like a lot of these diseases they can apply to a lot of people, but it's all about finding, like really trying to find like who really needs these medications and who can benefit from them, and who just needs to maybe work out things like cognitively instead. So one thing that I would recommend that pharmaceutical companies do is maybe get more involved with some of like patient organizations or organizations around suicide and depression to try to understand like what some of the unmet needs or gaps in trying to understand how these people feel and maybe like what their symptoms are, instead of just trying to come up with like these general set of symptoms that, like I said earlier, can apply to everybody at one point or another. Well, I'll be honest, I fell into this line of work, but the reason I've stayed for so many years now is because I really enjoy what I do. We do a lot of patient research, market research, so even though in the end we're trying to understand, how to sell better to these patients, we are also giving a voice from these patients directly to the pharmaceutical companies, which is not something, that patients get a lot of opportunities to do. So, they really appreciate it, and it makes me feel good about what I'm doing. So after a long week of work, I like to spend my weekends outside to like de-stress and decompress. So I do a lot of like long distance hiking, backpacking, a little bit of climbing, basically anything that keeps me outside all weekend. That's amazing. That's what I do to relax and like just stay like mentally healthy. Having a dog and like being able to like hug this little creature that loves you, it feels so good. So I always advocate, if you're feeling sad or something, just even if you don't have a dog, just a friend's dog or something, just hug them. It feels good. I would just listen to them talk and let them tell me how they feel, because I think a lot of people who are depressed or suicidal feel like they're not heard. I would tell them everything's going to be okay, and just some simple gesture like giving them a hug, something like that. I think that's a really good place to start. Tell them, that it's like things will get better. They always do. And then in the long term, I think I would try to help them find something that makes them happy. Everybody's got something, I think, in my opinion, everybody's got something out there that can make them happy and make them feel good. And I would want to work with, the person that I love, whether it's a friend or a family member, to help them find that thing. So
this has been Living Mentally Well with Kevin Hines, brought to you by 17th and Montgomery Productions. Thank you for tuning in. Subscribe below and let us know the thoughts you have in the comment section.